Sandhill Cove, and from afar, I think Maria, you're up north, and Elmer, you're out west. We're glad that you could dial in and be a part of this. We do have a couple of guests, but for those of you who don't, who may not know our corporate partners, I do want to just take this opportunity to introduce them, and then we'll get into our first guest. So many of you know Roberta McMenamin. She has been with Sandhill Cove for, gosh, probably over 10 years now, but has been serving LCS in some capacity for over 35 years. So Roberta, I report directly to Roberta. She's the Vice President and Senior Director of Operations Management. We also have Tony Hegel. He's our Senior Asset Manager. He's the really, I guess, defined as the owner representative, but our Senior Asset Manager. We also have Darlis Jones. She supports us from a Regional Sales and Marketing Director perspective. She works very closely with Jill and the team here. And lastly, but not least, our all-star guest today is Cassie Kinney. She is out of our corporate office as well, and she's the Vice President and Director of Litigation and Claims. So I did make some adjustments to the agenda, and we're going to lead off this morning with Cassie. So I'm going to go ahead and share my screen, and I'll pull up the presentation. So just bear with me here as I share the screen. Okay. So with that, again, welcome to our third quarter owner meeting. And one of the things that I heard last time was that we didn't leave enough time for questions. So we're gonna try and make sure that we leave time for questions, and we may pause throughout the presentation. If somebody has a question, we'll try and incorporate those in. Roberta, do you have anything that you wanted to add before we dive in, or?
No, I think that, I don't know if you changed around the agenda. Well, certainly hello everybody, but we're going to go ahead and have Cassie go first, and then we'll reverse our PowerPoint order here. So Cassie, welcome. I know that we spoke yesterday, and pleased to have Cassie speak with us about the liability waivers that I know that you've certainly heard about, and probably a lot of questions. So Cassie, I'm going to turn it over to you.
Wonderful. Well, thank you. I appreciate the opportunity to be here this morning, and I unfortunately am introducing myself to you on a topic that's probably not having a favored status right now. We have a climate in COVID, and it has called on our team in risk management in ways that we haven't had to do this before. So my role, I've been with the company now 12 years. I'm a licensed attorney in Iowa, not in Florida. So I work with Florida legal counsel on issues down there. And one of the things we look at is working with industry and COVID. So when you see things coming out like letters and you know, how we're doing certain things, and when we're forecasting, you know, how to deal with our attorneys and assurance adjusters and such, that's my job. So I work on behalf of the community and the residents and your investment in these communities to protect those assets by making sure that we're paying claims timely, that we're paying fair amounts, that we're moving them forward, we're addressing needs. And one of the things that came up, the genesis of this, is that we had industry leaders and attorneys, and you'll see it now on articles, talking about how as you are in reopening phases and doing more, and we're having less chance to put a little bubble around communities, it's like there's going to be a risk, an increased risk of contracting and spreading of COVID. We've done a really great job managing it so far. I think as reopening happens, we all get concerned about how are we going to manage that. And the industry had come up with this idea, and you've seen it around, that you can do this if you have people sign a waiver saying, hey, I agree not to sue you, as long as you take all the precautions necessary to protect me as well. Waivers have a certain legal enforcement pros and cons. They are enforceable in some states, less enforceable in other states. They have contractual elements. They have things that you give up. There's, it's usually, I want to say it is one-sided in the fact that I agree not to sue you in exchange for doing something else. But part of it, as I've learned from this, is that we have to communicate it with people, which is why I'm out here with you. You can't just hold someone hostage with a waiver. They can't not enter a swimming pool or a movie theater or something with and being turned away from. They have to communicate that you're signing something and what the point is. So you'll see that not only was I tasked with working with legal counsel to come up with what a waiver would be and who it would apply to, it was, how do you make it more enforceable by telling people about it, being transparent with people, giving us an opportunity to visit about it before we roll it out whole cloth, and then telling people like what the scope of it was. So as we're working through this, some questions have come up from some folks. Specifically, it's like, what is the benefit to signing? What are the ramifications of doing it? And I think I'm going to assume you guys know what the purpose of the waiver is that if you get COVID, that you don't sue us. But the benefit is kind of twofold. So you can see that when we looked at this, and in working with folks in kind of in a legal capacity, to us it was a two-pronged thing. Is that we also needed an acknowledgement. It was saying, hey, we're doing this because there's COVID in a lot of places. And we have done our best with social distancing, wearing of masks, washing of hands, restricting visitation to manage it. And as we reopen, how are we going to manage it? And so we did the acknowledgement part. So our proposed first part is the acknowledgement, which says, hey, I know COVID's out there, and therefore I promise to keep doing what I'm doing. And that's important for residents because as I'm trying, in my head, I was just thinking, not only do I want to make sure that I'm doing what I should do to prevent the transmission and the spread of it, I want my neighbor to do the same thing. I want to make sure that if I'm wearing my mask or if I'm not going to every restaurant that I want to or something, but if I do, I want to make sure that my neighbor and the people I interact with are taking the same awareness and precautions that I am. On the flip side, more the financial, I'll say that is that there is a cost to being in a state that Florida is not, that does not have an immunity statute or an executive order in it. And in your jurisdiction, it does mean that there are a lot of people who end up filing lawsuits. There have been lawsuits filed already in Florida for COVID cases with exposure and death. And they claim that we didn't do a good, or by we, I'm talking about the industry, didn't do a good job providing enough personal protective equipment, didn't have the right staffing, didn't tell us enough about the COVID risk and what we were supposed to do. Those are the allegations that we're seeing. We feel like we're doing a good job of that, or we're trying, whatever it takes, we'll work with you on that. But as we do this, we're saying, let's not sue this because these lawsuits will have a financial impact on the financial health of the community. You do have an insurance policy through Ironshore, which is a Liberty Mutual insurance company, and they do insure the community for medical risk and negligence, but there is a cap on insurance. How much insurance? As you guys know, you have only so much insurance. When it gets exhausted, then it's an uninsured loss, and you run the risk of where's that going to pay for. It is a big number, don't get us wrong, but there's two factors here, is that the insurance program is an aggregate, and your insurance is an aggregate with other people who are under the Ironshore umbrella program. And there are other states such as Texas and California and Michigan who are hotspots who also don't have immunity waivers. And I have to think about the risk that's presented, across the board for that. And then so in my head, I'm like, okay, so even if you do have some claims and we do make some payments on this, that will return itself in premium risk and financial risk of uninsured claims. And quite frankly, we get a heads up from the industry, and that's not us, that's an insurance industry, saying how in the future policy years, they may not insure and likely will not insure COVID related claims. So starting in 2021, we're going to see that claims for COVID are not insured. And so that becomes a risk directly to a community, and then that increases expenses and costs. And I'm not trying to be too dramatic about it, but it's just it's a financial consideration that I take into account. Again, when I'm doing a risk assessment, I'm saying, what's the risk, and how much is that going to result in my claims and insurance and litigation? And so from a risk assessment point, I look at who my risk pools are. My risk pools are visitors and people who come on site, my residents, both in a skilled setting and an independent setting. And so we have this thing where we say, okay, if you're a visitor and you're coming on site, we really want you to sign this because we can't guarantee where you've been from. We want you to pass the screening questions. We don't want you to share whatever. If you're asymptomatic, you may not even know you have COVID. But for our population, that is really significant. And we've seen in Florida where we've had significant outbreaks because of unknown or asymptomatic transmission. So it's a real deal. And so we look at this and say, okay, we got to protect people as we work through this, and we have to protect the financial wellness and your monthly service fees, your insurance coverage, and your ability to defend these claims. So I'm going to pause there. That's what it is. And so the questions I get is like, when is it in effect? Well, it's only in effect for the time that is the state of emergency for the pandemic. That's a federal government CDC. It could be preempted. If a federal immunity statute is passed, then a waiver would not be even necessary because it would be preempted by a different one, even if Florida passed one. And then this is not a condition of residency such that it's going to be something where if you don't sign it, your residency is threatened or your agreement is terminated. It's not that kind of thing. This is really more of, I'm going to call it a conduct thing as well as the waiver. And to that, we have sort of, and I've mentioned this to Roberta and Sean, it's like, okay, so I know that there's been a lot of questions about how it's worded. It's worded because it is a legal document, and some words have to be selected for a certain way. But I have gotten questions about, how it's worded. And the thing is that we're going back, and I don't have anything to give to you folks today. But one way to address some of the concerns we've seen from a resident standpoint is there, because again, I'm talking about risk pools. So I'm like, for people who are visitors, vendors who need this kind of coverage, do we want to stick with just the waiver? And then for life plan residents who are also have a contract with us, we may also be looking at kind of tweaking it to be a life plan waiver, which is more of an informed consent. And I haven't seen that happen yet. In COVID, I'm not sure what we've all seen before, it's also new. But if for an informed consent, it would be just for the life plan folks. So it would be more of the heavier on the acknowledgement part and the assumption of the risk and saying, hey, I know COVID's out there. I'm going to do what I can. I'm not going to come after you if I do something outside of that policy. And so it would be more of a behavioral informed consent as opposed to it's a different type of legal document. And so my attorneys have prepared for us an informed consent template for Florida that may be something that could be in consideration for your community too. But I still think that there are two buckets. So you have people who I can't control who are coming on your property, and then the residents who already have a residency agreement who I would really like to make sure that their asset is protected as well as their health and well-being. So I'm going to pause right there because I know there's going to be a lot of questions, but I'll kick it off back over to Sean and start with your questions.
Okay. Well, great, Cassie. Thank you for sharing that. One thing that I took away from that, there were many, but one of the things that I heard you say is that for 2021, insurance companies are looking at carving out COVID as being a coverable event, coverable claim. And I think with that, if we're just now seeing lawsuits coming forward, and when I say we don't have any here at Sandhill Cove, so I just want to make sure that I'm clear on that. But as more and more come on, I think that we'll see more and more in 2021. So that was my big takeaway.
So like even now, insurance, like people who are renewing in September, and for the end of this year, whenever your renewal is, insurance companies right now are excluding COVID. It's just that we were able to, on our renewal, which was June 30th for your community, we were able to give them enough actuarial data and show them that we were a fully funded program and convince our broker and the insurance company that we were a good enough risk that they did not do a exclusion for COVID, but they did put that cap on damages. So, you know, we have it, and it was a hot issue, a contested and negotiated agreement, but they also gave us a heads up that we're probably not going to keep getting them, depending on our results. But for the industry, right now, you are going to see insurance companies, and you'll see it in the news or some articles about how people are already not writing, they're either not writing long-term care or they're not writing COVID. And so we've seen companies get out of the business of being in our insurance business because of COVID.
Okay, well, great. Are there any questions from the floor here? If you have a question, you know, feel free to raise your hand, and we'll unmute you. Or
if it's something where you want to write out an email or have specific questions, I'm absolutely able to work with Sean on questions that are that you feel. And I'll tell you, there are a lot of questions you think are individual, but we've seen enough of them that I can take a stab at it. And if I don't know the answer, I'm happy to go back and get it an answer or research something.
Okay. Anyone have any comments?
Hey, Sean, I'm trying to do my hand the right way. So Cassie, with the COVID specifically that you just covered, is that going to include all language for all pandemics?
This one right now, we're only looking at COVID. There you will see, and this is a business highlight for you guys, that in our residency agreements, which don't apply, you know, it's kind of a prospective thing, is looking at revising the residency agreement that would include a bigger, a natural disaster, being a pandemic kind of thing. But it wouldn't be a waiver. This waiver, and part of waivers has to be for a specific set period for a certain thing. And so this is only for COVID during the period that COVID is considered a state of emergency pandemic.
Right. I meant the insurance itself, as far as what they're not underwriting for 21 or any new renewals. Are they going to have a blanket covering pandemics, or is it just going to be specific to COVID on insurance?
Specific to COVID on insurance.
Okay, thank you.
Okay, well, Cassie, thank you very much for joining us. We appreciate your time and imparting your knowledge about this. I know it's probably something new that you're learning about and learning through as well. So thank you very much.
You're welcome. And I know you guys are going to have opinions and questions and feedback. And so please, I'm happy to think through other issues with you and work with you again, trying to see what we can do to help you guys out. So
great. Well, thank you.
Thank you, Cassie.
Have a great day.
All right. Bye.
Bye. All right. Go back up, and Roberta.
Sure.
All right. Kick over to Roberta for her LCS update. Thanks, Roberta.
Sure. I've worked very closely with Cassie on many things COVID since the beginning of March here, and I don't want to take too much time. This is in I'm assuming the PowerPoint deck that you have been sent as well. But I just wanted to give you a perspective and be able to answer questions too about, you know, what LCS's response has been, not just what you see here at the community, but kind of globally. I know some of you also go onto our website there. So I just want to really quickly go through the timeline here. And as far as a task force at the top, you know, the entire official task force started in beginning of March on the 4th there. So when you're talking about how we kick things off, there was certainly a lot of scrambling corporately. And then I was on what we started off as a business continuity plan. I actually was on a committee for that. And we had corporate leadership, Joel Nelson, our president, and others. And then we had a true task force that I was on with 5 other people, where Joel and Allison, my boss, and others would pop in, and then a core group of us that were in operations that were working on our pandemic plan. So we started off with a true business continuity plan. We also quickly corporately engaged, going to the second bullet here, crisis communication. We had 2 different firms that we engaged with. One that was focusing a little bit more on LCS and our certainly communication and media strategy. Then secondly, we had another one called Wickstead that was more focused on our communities. And all of these, it was a playbook that was actually, which is the 3rd bullet point there on the timeline, that I'm sorry, I'm getting a little bit of feedback. We had a communication playbook that had every single letter that in communication that would need to go out to residents, employees, and others, and even with the media. We had this firm Wickstead that we worked with to develop this playbook. It's numerous pages. Darlis is well involved with that playbook. But those letters, though, they were great, probably coming from Sean. They had a backbone to them to have template letters and communication to be able to communicate, as I said, with our various publics, and particularly to be ready, set for media. There was even training that was involved with our EDs and administrators. So that was a really big nut to crack there, getting that all ready. Also, the 4th one there, tracking and providing communities with PPE. There is a gentleman named Blake Gilman who heads up our health services division. He kind of got a new full-time job working on all our PPE and our procurement of that for our communities. We had masks initially when we couldn't get masks, and then gloves when we couldn't get gloves, sanitizer when we couldn't get sanitizer. So we use CPS, certainly you all know, as our national procurement company, but he actually started getting involved and leading that effort and drop shipped all these items to communities. That we're kind of at the point now where we're able to get what we need. Gloves was, I think, the last run on things where we had to drop ship, but we got that all coordinated by Blake and his team. So just really proud that we could come together and do that corporately. The 5th bullet point going down there, a case in community tracking. I won't get into all of that, but just tracking all of this corporately, what's happening individually at each community, and then rolling it up to LCS, because we had to report on that and also be ready for that information. So we're able to use our system, our CRM system for marketing, which is called Salesforce. We're actually able to add kind of a software program on that to track all that through that. It's a separate component, so we could track all that and roll that up corporately, so that Sean and Aaron and others at the community are putting in their data for each community. Instead of sending me emails and telling me what's going on, they do that as well, but we're able to pull that all up together for our reporting, and we can tell what's going on at each community, and they keep that up at the community level. Other information that just kind of moving along here pretty quickly, that we have weekly information, and it says weekly information share.
Roberta, you're muted.
I muted myself. We were having calls, Life Care Services calls with Joel Nelson and Rick Exline from Ops and Chris Bird. They would rotate, and my boss Allison, 3 times a week, where all the EDs, all the administrators were on these calls for an hour, 3 times a week, because this was hitting hard and fast with what we needed to do to quickly shut down and what's open, what's not open. And then, as I said, our business continuity team rolled out a lot of policies and procedures and details. So we're holding those calls corporately to support our communities. Lots of webinars from marketing and EDs and even some of our different departments, our community life services, and a lot of the other departments, all of the departments had calls to be able to share best practices and ideas. Probably the seventh one down, tracking our provider relief funds. As you know, that our communities, particularly those with skilled nursing facilities, have received provider funds, the stimulus funds. So we know that Sand-Hill Cove, that you have received those funds. And we are corporately tracking that and also providing feedback and details back to Debbie, for instance, of how we're to track that and all the side Excel sheets and those kinds of things to be able to prove that how we use those funds. Way down toward the end of the line here, that we're working corporately on advocacy and legislative activities. That's more at Joel Nelson's level, working with some Leading Age and Argentum for our assisted living communities and other senior housing CEOs and those groups. The reopening process is where we are now, so a lot of that was behind us. And then, as I said, I was on the business continuity group, and I was part of 5 people who developed some of that reopening. So I know that inside and out on that 60-page document that Sean and Aaron have to use for opening into our phases, the 3 phases that we're in phase 2 there at Sand-Hill Cove, but phase 3 yet to come. I don't know, Darlis, if you have much you want to say about marketing and sales, but a lot of discussion on opening, what we can and can't do in marketing, and marketing and sales teams that each of the regionals like Darlis are working with their teams on how to shift ourselves from a digital world, which has been a major paradigm shift for us in our communities. And then lastly is just the final ramping up is that now we're going to be taking what we've learned through COVID to really look at pandemics in general. We have great disaster training manuals, we have great infection control manuals, but this came on fast and furious, and we're going to be able to take what we've learned here to apply to hopefully never needing it, generalized pandemic. So kind of talk through that pretty quickly, but wanted just to let you know here what we've been doing from an LCS lens. You're seeing the result of this at the community level. And Darlis, didn't know if you wanted to make a quick comment or two, and then certainly any questions anyone may have.
Actually, my portion a little bit later in the agenda, I think we'll touch on some of it, but yes, no, a huge shift obviously for our sales and marketing teams in this COVID environment, where I kind of joke about where we, in the years, many years past, we've always talked about, gosh, we really are going to have to go virtual someday. And we have had to go virtual very fast and furiously. But lots of tools created and developed for our teams, including a box site. So a site where on the LCS portal, if you will, communities can go for all kinds of resources and ideas, et cetera. But I'll touch a little bit on it later on.
Yep. Okay.
Okay. Any follow-up questions for Roberta? Okay, hearing none, we will, Meryl, I'm going to kick it over to you. I had, unfortunately, I had to update the agenda at the last minute, and I removed accidentally Meryl, but he's going to go over the communication exchange. And I think many of you have seen this before, but I think it's just a good review for us to be reminded of it once again. So are you able to share your screen? I see Audra there with you. Thank God for Audra. Give her a round of applause.
Come on. I just push this button, all right? Okay, can everybody hear me?
Yep.
Okay, all right. I'm going to talk about the Communication Exchange Program, which was a program we initiated here with really an objective of starting a dialogue with an ongoing dialogue with our residents. And we started in 2019, we got in as far as the first month of 2020, and boom, the pandemic hit, so we kind of lost our continuing project. But we learned a lot, and what I'm going to take you through now is our first 4 sessions, which involved 40 people, 40 residents here, talking about 2 specific subjects. The first one was what makes Sand-Hill Cove special? So we're looking for what they consider, the residents consider, are the unique qualities that set us apart from our competition in the area? And two, what could we do in the way of improvements to make us even better? Not a gripe session. We don't want you to sit there and tell us that the Brussels sprouts were cold last night. That doesn't help a lot. What we need is to get some ideas of what could be improved so we would be even better than we are now. So I talked to 40 people in 4 separate groups. I should also say that on the what makes us special, I had done previously a series of about 30 one-on-one interviews with some of our residents as well, and there's a little overlap. But so roughly in terms of what makes us special, we have probably 60 people inputting or so. The other part, we have 40. So let me go through this. We're going to go through what makes us special first, and then we're going to go through the improvements the residents suggest that would make us even better. And it didn't go. What didn't I do? Okay. The first thing that comes up when you say what makes us special is people. And by people, what our residents mean is both the residents and the employees. They think of them as sort of a combined unit. So they're not just talking about themselves, they're talking about the employees as well. They describe the residents as diverse, intelligent, friendly, well-educated, social and outgoing, and a bunch of other things that are all very favorable. So you have a bunch of interesting people that they live with, and that's what they think makes us special. They also think that the employees contribute to that, and they are described as well-trained, attentive, anticipate your needs, they're genuine, they really feel what they feel, they're patient, and they're upbeat. But I think it's important that we think about this as almost a combination. These people are really attached at the hip as far as our residents are concerned. They both contribute to making us special. And what makes it even more so is when you turn to the next item, which was our culture and values. What came through? What makes us special? It's a feeling that we're like a family, that we care about one another, that the residents always look out for each other. And by the way, the employees look out for them too. So the staff treats you like you're the only one. So there's a very personal feeling about this. This is what brings the staff and the residents together so strongly. The second one that's very important, the security and safety value, if you will. It takes place in 2 ways. The physical, yes, the gates and security are important to reinforce that, but the emotional side is probably even more important. Someone always has your back. That someone may be another resident or that someone may be an employee, but you always feel like you've got that relief. That creates a lot of less stress for both the residents and, by the way, their relatives. I've got a daughter up in Maine who thinks it's just great that the old guy is in this place and everybody's looking out for him so she doesn't have to worry so much anymore. The final one I have here is a sense of being carefree or liberating, and this applies to the fact that everything is taken care of for you here. So you have more time to do what you want to do. You don't have to waste so much time on what you must do. So activities such as worrying about the lawn guy, the pool guy, the plumber, the electrician, you don't have to worry about any of that anymore. They take care of it for you here. That also creates a feeling of less stress. Now, both of these items you saw are sort of on the intangible side here. So what about if we talk about a tangible item? What makes us special? First and foremost, the site. We're on the waterfront. It's attractive. It's distinctive. Chances are nobody will ever be able to offer you that kind of situation because it's too expensive to buy the property to start with on the water. But we have it, and it stands out for Sand Hill Cove. The proximity is important in location. Easy access to town, to Palm City, Stewart, even West Palm Beach, because the highways are very accessible. You can get on the Turnpike or 95 in a heartbeat from here. And you're also close to your friends. A lot of people here have come from Monarch or Willoughby or Pipers or Mariner Sands. They can get to you easily and you can go visit them easily. It's very convenient. And lastly, in terms of location, it's very quiet. It's like an oasis. When you come back through the gates, suddenly you're home. And the hubbub that you were just in, whether you were in West Palm Beach or Stewart, makes no difference. It's all gone away. Everything is quiet and peaceful now. Next, the offerings are what makes us special. Activities, lots of choice, something for everybody, and no pressure to participate. Very important. It's all here if you want to use it, but you don't have to. I've got a sister up in, of all places, the Villages. They got a lot of activities, and the pressure to participate in every one of them is incredible. So if You can't sit down and read a book up there. You got to play. This helps keep people young, as does the health and wellness. That's the second important offering. Water's Edge is on site when needed. It's right there. It's not 2 miles down the road like it is at Devonshire. It's right here if you have to go see your spouse. Also, the gym, which is described as good, even though it's not huge, it is good. The exercise classes are good. The pool is good. It all helps keep people feeling young. These are all important aspects of what makes us special. The campus, the size, it's compact, it's manageable. You can get around here very easily. You can go from one place to another. And you know what? You know more people here. If you had 800 or 1,000 people here, you might know a percentage of the population. Here, it's much more personal. You may know almost everybody, in fact. And the condition of the campus is critical. It's well maintained. It's clean. It has beautiful landscaping. It doesn't show its age. It plays well with your friends. You bring a friend here and they're sort of overcome by, my goodness, I never expected a place like this to be. Where did this place come from? So the campus is critical. Lastly, on the special side, what makes us special? Our residents tell us our management here at Sand Hill Cove. We are well managed and there's a very visible presence, which of course I think really plays to the survey that we took in 2019, which demonstrated that management here had risen some 10 or 12 points since 2017. That's, of course, a credit to the gentleman, or I should say the executive director here, who is the visible presence. Now, what we can improve in the minds of our residents that would make us even better. First, communications, information, more and more often. They really want as much as possible. They want easier access to information for those people who maybe aren't as facile with a computer as other people are. We want to make sure we reach everybody in this and that we make a clearer presentation. And what that turned out to be was the News Weekly, which is terrific. It's jam-packed with information. Some people are almost overwhelmed by that. So we might want to have to think about how to streamline that a little bit. The important thing is keep residents up to date. We've been doing that very carefully during the pandemic. We've been on the air anywhere from 1 to 3 times a week reminding people, and people really respond positively to that. The second big thing, technical equipment, Wi-Fi, telephone, television, and internet. It is very important to our current residents. It's going to become even more important when we start talking about the next generation showing up, where technical stuff is all part of their DNA. So we've got to have up-to-date, perfect, practically perfect technical equipment. Rumor control, a wish list one. You get the real story out there first to dispel the rumors. All communities have rumors. You can't stop them all, but you can try to get out there ahead of them if we use communications wisely to heighten the awareness of the issues and get the real story out there first. So communications was the first thing that jumped out at people as something we could improve. Housekeeping, very important. They want enhanced cleaning. They want more and better weekly, and they want more than one annual. Again, that's the ideal, but the message we need to get is that they would like more cleaning for most people. They want more efficiency perhaps in that. They see people moving from waterside over to a villa for the next clean. They're pushing their carts all the way across. There must be an easier way to schedule things so people can move from one to the other more efficiently. And lastly, tailor the schedules a little bit. There are some people who would only like cleaning every other week. So some people who would like it weekly or more, maybe they get that, and some other people get it every other week. There might be a way to schedule that. So housekeeping was the second one that came up. Transportation, buses. They thought that we could use some more buses, particularly to get the Publix and upgraded models. There's some that are getting a little long in the tooth and they could probably be updated. Parking, a big issue. Cars permanently left in spaces. Their feeling is if they're always there, they never go out, why do they have a space? The use of guest spots, which has improved quite a bit since we put in some new rules on that front, but there are still some people violating those rules and parking in the guest spots, and more spaces in general. I think you can sense here what the real problem is I don't have a space close enough to my apartment is really what they're trying to say to everybody. Now that's physically impossible, but we can do our best to get the parking adjusted somewhat. Lastly, abutments, the feeling was that they're all plain and not very obvious. Maybe we should put some color on those things instead of the gray or cement color, what they are. Avoid people from tripping over those things. Next, newer enhanced facilities. And these are kind of as we go through this kind of an order. So as you get to some of these things, they're not as important as some of the first ones I talked about. More comfortable movie showing venue. We've heard this in these sessions. We heard a lot of anecdotal references to the same thing. Fitness center. Our people here would like more equipment and more exercise space. So it's not just the new people that are going to come the next generation. People here would also like more space. Some people, one or two, mentioned having a larger card room. Okay, they have some big events there where we have competition with outside people like from Stewart or from another community. Maybe they do need more space when they hit those kinds of things. We have to think about it. Pickleball. Well, the other clubs have them. Well, we know it's coming too, but I was surprised that our people here picked that out right away. We may need pickleball. Charging stations for electric cars. That's pretty far off, isn't it? No, not really. There are going to be probably electric cars here before you know it. We're probably going to have to think about charging stations. A few things toward the tail end, some maintenance things. There's some sense upon occasion that some projects do not seem to get finished, that they cited some back and then. This is back up fall in January. You know, the pool deck, the walkways, and some apartments seem to have some mold in them, so they cited those. We may need more oversight and follow through on that. Storm protection, which I think we all realize we need. We are protected, but it's with shutters, and people, of course, would like impact windows, and they'll cite the fact that Devonshire has them or somebody else has them, so why don't we have them? More generators, because at nighttime, you'd like some light as well as during the day. And lastly, a couple things about the marketing process. Suggested about a practical referral prize, maybe a gift card to Publix or CVS or something like that, maybe would be more useful than some of the prizes that we've awarded, maybe not. The new resident integration I thought was important because what that is our social committee and our marketing committee do a great job when people get here. In the first 2 weeks, everybody's dance card is full. At the end of the 2 weeks, all of a sudden it stops. And the suggestion was maybe we could stretch that out a little bit more. And I've actually talked to social committee members and marketing committee members about maybe doing this and staggering it a little bit more so it stretches out to 3 or 4 weeks so people don't get dropped after the first 2 weeks. Okay, that's what we learned out of the communication exchange. Our hope is that after the pandemic subsides, we were going to go back and continue this dialogue, continuing on different topics and always keeping on top of, as best we can, what the residents are feeling. So that concludes this presentation, Sean, and we can go on from here unless people have some questions.
Okay, Meryl, thank you very much for that. I'm still stuck on the comment that your daughter thinks you're an old guy living in a retirement community in Florida, but.
Well, that's from your perspective at 49, pal.
All right. Any questions or comments towards Meryl? And I do want to just say thank you very much for the communication exchanges. I must confess that I thought it was, that it was a little, it can always be a little hairy when you're pulling people together and because it can become, as you said, I think a bitch session, but I'm grateful that you have that skill set to be able to keep people on track. So thank you. I think this information is very helpful.
Can I just add a comment? I think, Meryl, you've just provided us with our SWOT analysis that we usually go through in the fall when we get ready to put the plan together for next year. So thank you for doing that work for us.
Welcome.
Yeah, I just wanted to also add, Meryl and Sean, I think I mentioned this to you and I copied back Tony and Darlis. You just did our resident satisfaction survey for us. We do those every couple of years, and those are usually the summary results of those surveys. Without the quantitative, it was the qualitative, and it was great, and really appreciated the comments.
Good.
Okay, well, with that, we'll keep this moving. I think, Aaron, I think you're up. I've asked Aaron to give a little community update on COVID, but before I turn it over to her, I do want to just say thank you to her. And I've said this before, but as the nursing home administrator the pressure is on. Yes, we feel it on the independent living side, but we don't have the regulations, the regulatory compliance that Erin is working under, and she has just done a fantastic job at leading the department, the health center. So Erin, thank you to your leadership and your commitment and just staying strong for the community and our residents. And so with that, I'm going to turn it over to you for a little community update.
Thank you. And it's just all in a day's work. And at least you didn't make me cry this time. All right. I think one thing before I get into some of my other notes, though, that I would like to point out, as Roberta mentioned, Sandhill Cove is in phase 2 of our reopening, but it's really important for everybody to remember that's very different, though, for Water's Edge as a health center. Nursing homes, assisted livings do not progress into phase 2, phase 3, whatnot until the community at large is basically at the end of the reopening phase. So we here in Water's Edge are still in phase 1. And I know that can be a little bit confusing, but it's important to understand. So we have some stricter guidelines in the community at general goes. That being said, on the positive point, I'm really happy to be able to say that as a community, we are COVID-free at this time. We have no active cases for residents or staff, and that was a lot of work to get us back to that point, but our staff has been diligent, the residents have been diligent, even though everybody isn't always happy about some of the rules that we've had to put in place. They've been following them, and we've been able to get the cases that we have had of COVID out of our community. And our unit here in Water's Edge is officially shut down at this point in time. So we're very pleased with that and are working really hard to keep it that way. To do that, we will be continuing with those daily screenings. I don't see that ending anytime soon, even as we currently go through progressive phases. I think those screening processes will be in place for a very long time to come. And it is very important because we do know the key is to catch this before it gets into the community, and that's a part of those preventive actions. So everybody who comes on property will continue to be screened, have their temperatures taken. We have also invested, they're not here yet, in some of the digital temperature screenings where you don't need a person, that we can keep in Water's Edge as a secondary device when people come in, as well as a visitor or vendor into this part of the community. Our staff also get temperature screenings in the middle of their shift, and that will aid them in that process as well. So those will continue. Our COVID testing, we're required by law, and think it's the right thing to do. So we will continue to be testing all of our employees every other week. Our employees, for the sake of the testing, also includes contractors and private duty personnel, vendors, basically anybody who comes into Water's Edge and has that potential for direct contact with our residents. So they all get screened. Hospice individuals that come in are either screened through us or they bring a screening with us. The pharmacy consultant who comes in, he brings his screening with us. Everybody knows and complies with that. So
Erin?
Yes.
Erin, and I just want to clarify here, and when Erin's talking about the testing of the employees, she's speaking about from the perspective of Water's Edge. So I know that there's been I just want to bring clarification. We are not testing independent living staff. We are following the guidelines of the AHCA, the Agency for Healthcare Administration. And so when Erin's talking about testing staff, that's who she's referring to, are people who work in Water's Edge.
Correct. Other individuals will be tested if they are identified at risk, either through contact tracing of a positive or symptoms. So we will test out independent living employees under those conditions. We also test new hires into Water's Edge prior to starting, so we get the results in place as well. And then our residents in Water's Edge, everybody has completed baseline testing. We do not continue to test them on a reoccurring basis unless they either show symptoms or, again, through contact tracing of a positive result, there's that potential for exposure. The only ones that are tested outside of that would be new residents coming in. We test them at the 14-day mark to verify that they are indeed COVID-free before they come off of their quarantine, which I'll get to a little bit more about that. As I said, our COVID-19 unit is currently shut down. We do have it ready to go. We didn't dismantle everything. We just don't have anybody back there because we have no positive cases. We've made it a little bit smaller because we've just felt there's not a need for 5 beds back there. We can expand it if we do ever get to that, but hopefully we'll not. And we'll be able to maintain it and keep it shut down. We have also created what we call a PUI unit, which is person under investigation. So anybody who comes to us who is new from the hospital or outside community, they go into what we call our PUI unit, and they are under quarantine there for 14 days and then retested before they're exposed to the general Water's Edge population. And that's to allow time, because we do know hospitals are a big area for exposure. And somebody coming in from the community, we don't necessarily know what's happened and the exposure they've had. So we want to make sure we have adequate time for an incubation period to where if they have been exposed, for it to be present and shown, and then we'll retest. And as long as they remain negative, they are then introduced to the Water's Edge population in general. If they are positive, obviously they would go to our COVID unit. But so far we have not, and the hospital does continue to test, and we usually have those results because they'll do rapid tests before they come in. But this is a precaution that's been recommended by the Department of Health that we are following to help keep the community safe and COVID-free. On a note, as far as the resident well-being goes, visitation is often asked about and questioned. We are not permitted to allow visitors into our building, so we are not doing so, but we do continue the outside visitation. That's been seen by the Department of Health. They've said that that's fine with what we're doing, that it's safe, we keep that distance, and they have the mask going, and the people who come on are screened, as mentioned before. There is a task force in place with the governor to talk about visitation and ways that nursing homes can do it safely, but at this point in time, they have not released any guidelines for that yet. We're hoping that will be soon, but until those directives are given, we will not be doing visitation inside the building. We do have, as Roberta mentioned, the supplies. We are well stocked here. I've worked very, very diligently on that. The staff can tell you we have it. And then the resources, we've been fortunate by being a part of the LCS community, have put us in a really good position to be well stocked with the supplies on hand. And that's good. That gives the staff here and hopefully the residents here a nice level of comfort that we are able and positioned to manage this. And, other than that, we continue with our day-to-day activities in Water's Edge. We have things going on. They're just very, very small groups of 4 individualized activities, and we work very hard to keep connections going with families through technology, FaceTime, GoToMeetings like we're doing here. We have a Google, I don't remember what it's called, but it's another device, another platform to where you can do face-to-face
Google Duo.
Communication. A what?
Google Duo. Is that what it is?
No, it's not Duo. I would recognize it here. It's not Duo. Michelle found it. It's like theaters, I don't know, something. But anyway, it's just, we've tried to create as many opportunities as we can for those connections with our residents, and life is continuing on, and we're doing well here. So that's what I have, unless anybody has any questions.
Hearing none, Thank you very much, Aaron. We
Excuse me, Sean, I do have a question. I'm a little confused, Aaron, about the level of testing for the cleaning help that show up in our apartments on a weekly basis. Are they given the temperature test? When you talk
Yes.
about testing, is it a temperature, just a temperature, or is it a nasal swab, or what for the people who come in the resident establishment?
They go through the daily screening process that everybody who comes onto our campus goes through. They are not getting the nasal swab test, no.
Thank you.
As
You're
as
welcome.
part of that daily screening, it does include the temperature taking.
Yes, yes, it does.
Okay. All right. Thank you, Aaron. So I am up now, and so just to clarify, we are primarily in phase 1 with a couple of bleed overs, a couple of things in phase 2, but not completely in phase 2. So, and that is because Florida really blew up, and in phase 2, it would allow us to have up to 50% dining. So I'm going to go over phase 2. I'm going to skip over phase 1 and talk to you about 2. And this information is as of Sunday. Basically, Florida is trending downward, and it had the 7th straight day below a 10% positivity of new cases. We are all aware of what has occurred in Miami-Dade County. And so we look to Miami-Dade County, and they too have also fallen below the 10%. So I think we're seeing some light at the end of the tunnel, a flicker, I should say. I see a flicker, but the good news is that we are seeing a downward trend in the percent positivity of new cases. So that will help guide us into moving completely into phase 2. These are the statistics for Martin and the state and the statewide. Martin County, we always look at the deaths, 3% of all cases, statewide, 2% of all cases, and they also look at the hospitalizations. I'm not going to go over this any further. If you're interested in seeing more of this data, you can always go to the Florida Department of Health's website and do drilling down for yourself. It is good, interesting data. This is the percent positivity for Martin County. As I referenced, you can see here back on the 17th, we were as high as almost 14%, and then it's trending downwards. So that's good for us. Opening up Sand Hill Cove again for phase 2, we look at the COVID-19 death rate. It needs to be less than the benchmark. We look at the county case rate. And then the other thing is that we have 0 active and pending cases in all levels of at Sand Hill Cove. And so we are definitely, we definitely do not have any active or pending cases. So we're definitely sitting in a position where I will be talking to Roberta more about some of those other items in phase 2 that we have not been able to implement to see when is the appropriate time to do that. So looking forward into phase 2, what that will look like is meal pickups available by reservation. And Roberta referenced this in her discussion, that as part of her responsibility on the business continuity team, they created this, helped to create and shape the opening up plan. So where I'm getting this information is from the LCS opening up plan in the various phases. So meal pickups available by reservation. Sit-down venues are open with limited seating to capacity of 50%. So in phase 2, that is something that we can do. We just need to work out the details of that. And so I would be working with Jim Rondinelli and Merrill, and you know, probably some of you on how we do that. What we have been told in other communities that have opened up their dining rooms, interestingly enough, people are still choosing not to come down and even be at the 50% capacity. So I thought that was kind of interesting. So we'll continue grab and go. Marketing, you know, right now Jill is meeting in the villa for marketing appointments. And in phase 2, that would continue as well. However, I'm trying to, what it does do in phase 2 is it allows us to do some off-site events. But what it's saying is that staff may meet with up to 10 prospective residents off-site with social distancing. So it's not the large groups that we used to do, but in phase 2, there is a provision where we could potentially do some off-site mini events with up to 10 prospects. And I know that I know that will be an important component to keep our sales and marketing efforts going. Visitation, if the community is COVID-19 free for 30 days, then interior space may be created for family visits. Right now, we continue to do visitation outside. Community life activities for groups of 20 or less. Right now, we're doing 10 groups of 10 or less. COVID-free outdoor activities, we can do up to 50 residents. So maybe we do a movie on the lawn, or you know, have somebody come in and do a concert for us or something like that. But that's what phase 2 will allow us to do. Transportation remains essential to medical appointments. And so that's basically where we're at with phase 2. And because the numbers are declining, like I said earlier, it is time for me to have a conversation with Roberta and see what part of phase 2, what else in phase 2 we can move into. So are there any questions on phase 2 or anything that I have said regarding that?
Hey, Sean, if there's not a comment, then I guess my comment would just be, as I said before, and as Sean mentioned, is that the phasing is a guideline. We could certainly be less restrictive. It doesn't mean because these are the things in the opening up guideline that a community can do in phase 2. Everything's discussed at the community level, and I know that Sean speaks with the resident leadership about that. So some communities have done these, like I said, a little bit of not all the way saying phase 2, but they're saying, you know, 1E, they got down to alphabet letter E, where they're borrowing a few things from phase 2 and getting permission, but not maybe doing everything in phase 2. So it doesn't mean that you have to use your own community data and what's going on in your own community. And some residents want things open, but then when we open them, like dining, they're not actually coming. Most
Right.
communities, even though some of them are in phase 2, they're still at 25% dining, which is a phase 1 option. And then when they go to the 50%, it's really not much different because residents are opting to stay in. So it is fluid. And the only other comment to make is if our guideline suggests something can be done, then something stricter in that state, then obviously we can't do that. So it's taking all that in combination. And there's an actual form. It's an approval form to move from phase to phase that goes from Sean and Aaron to me. And then I give that to my boss, and then we approve that, and then that is approved corporately. They're keeping track of where every community is in their phasing. So just to add a couple 2 cents to that.
Sean?
Yes.
Yeah, Don Alex here. With the outdoor activities, would that also include going back to having the water aerobics classes?
Yes, I actually think, Don, that we're going to be able to move into the water aerobics sooner than later. So probably within the next week or two. That was on the discussion, up for discussion with Phyllis and Jane. So be looking forward to hearing something on that, maybe even by the end of this week.
Thank you.
Yep, thank you. Okay, so we're gonna kick it over to Debbie here. Hi, Debbie.
Hi, Sean. Hi, everybody.
I'm gonna just advance it for you. There you are.
Thank you. So we would like to share with you what we project the year is going to look at with all the things that are going on with COVID. So what I want to start with is the very first column. That is our original 2020 budget for revenue and expense. And you see the net operating income on the bottom would have been $1,985,662. We've had 7 months of actuals. That's the second column. You'll see our net operating income at $1,343,000 for the first 7 months. Then we're projecting from August through December, where we think it's going to be with still having COVID, with net operating income of $566,000. So if we combine all those figures together for January through July actuals and August through December projections, we're projecting a net operating income of $1,678,000. Now we compare that to our budgeted net operating income. You'll see we're short by $307,000. One of the things that helped us actually, if you recall, was we got those stimulus checks. So if you go back up to the other operating revenue, all the way across to the actual and projections, January through December, you'll see our other operating revenue is $291,000. We're anticipating for the year, but only budgeted at $92,000. So that helped us out by $200,000. So you wonder, what are some things that are causing these situations? If you look at the very last line on the operating expenses, you'll see through July, we spent $231,000 on COVID supplies, which is masks, gowns, gloves, cleaning machines to go through and clean the rooms, things like that. We're anticipating to be up to about $246,000 by year end. But what you will see is that we've been trying very hard to control expenses as we can. You see food and beverage, particularly now not having open dining, has been able to really cut back on staffing, and that has helped tremendously. And everybody else is doing the best they can possibly do to mitigate our loss in revenue. So if you want to go to the next page, I'll give a little more detail on the items. These are the major contributing factors to our situation right now. Second person fees, again, this year, we still continue to trend under what we budgeted for second persons. We've made another adjustment for the 2021 budget to even reduce it a little bit more. We're obviously not having any guest meals. We have no guests on site to have guest meals. The lounge isn't open, so we don't have our lounge income that we depend on, and our guest rooms are closed. So those are pretty big numbers right there, as you can see. Aaron may want to speak more on this, but on the health center, right now we're trending 24, right? Correct? Typically, we budgeted, I think, 31 or 31 and a half. So our census is down considerably. You'll see in all the different areas, it's down considerably for our revenue for the health center. Then the assisted living, even though we are very close to budget, we've had a lot of what we call temporary assigned residents. So the residents to get those first 90 days free at the assisted living. We've been getting 2 to 4 temps so far this year, and there's no revenue that we get to offset for that, even though they're in the rooms, in the beds. But the good point of that also is that it's still the revenue in the apartment. So it helps with the monthly service fees. So, and then the last section is directly just COVID, straight COVID, is the stimulus payments of $251,000 we received, our COVID supplies, and then we've had the COVID unit open for a time where employees were getting extra pay. We also originally in the beginning were giving COVID pay to all the employees, $1 an hour. And then it was $3 for people working on the COVID unit. So that gives you an idea of where we're at or where we're going to be. And we're hoping we could change that and maybe improve it if we can open things up sooner. Any questions?
Thank you, Debbie.
Thank you.
Right, so next we have Joe. Hi, Joe. Is she with us?
She's on mute. Oh, there you go.
I do that every time. I forget to put my microphone on, but hello, everyone. So our net sales so far has been 18. We did have one cancellation, and I actually had someone coming in yesterday to sign for a contract that canceled the morning of, but still that's not too bad because in regular times, we do a lot for 2 to 3 cancellations per year. So we've been doing pretty much pretty good. And then we had 14 that closed. And at this moment, we have 4 open apartments that we're working on. The public is taking much longer to make decisions, the people that we're working with. I know Sean has been recently assisting me with one because her son is a lawyer. And so we've basically been going through the whole contract for about a week and a half. And so it is taking longer to convert sales at this point. And basically what we're hearing in the marketplace is that the real estate market is doing exceptionally well. I feel an echo. Can you hear an echo? Or is it just me?
A little bit.
Okay, maybe I'm too close. So the real estate market is doing very well. And there's less inventory than than this time last year, and there's actually more sales. Basically, from what I'm gathering is that sales are coming from out-of-staters. So we have, for the month of July, we had 275 listings. And then in 2017, we had 253. So we've actually had less listings. But the inventory is 275 this year. And, I'm sorry, the inventory was 429 and last year it was 334. And so again, people are coming from out of state. They are buying properties. So, the good news for us is that if we're working with people, that's one hurdle that we don't have to bear, is that they should not have any trouble selling their home. The unfortunate part is that when they are selling their home, they're not looking at a retirement community. So we're not really reaping the benefits of the good sales in that respect. We are hearing now the election, obviously, and this happens with every election, not just because of COVID. It doesn't help that we have the COVID mix, but anytime there is an election, everyone wants to wait to see if their guy gets in, and then right after the election, everybody goes back to planning for the future. So for some reason, it puts a freeze on for some people looking, and the one that canceled the contract on Tuesday was specifically mentioned that she was concerned with the economy and it was an election year. So plans for the remainder of the year are obviously we're working with our ad agency to do direct mail. We have a piece that actually dropped yesterday, And it was actually a very good piece, not focusing on the negativity of COVID, but the positivity of what we can offer in such a, pandemic, such as our concierge shopping, picking up prescriptions, our meal delivery, a lot of those things that they actually can't get at home. And so we're hopefully reaping the benefit on that. We purchased MailChimp, and MailChimp is an email system. So we are now working with MailChimp so we can do email blasts, and we're also working with LCS on some of their webinars. So we have Andrew Morgan, who's training Darlis, is that his title? But he's a very positive person. So obviously we're having a positivity webinar. So we were able to mass mail to all of our prospects for that. And we are in the process of trying to fill a position here. As you know, Adriana is having challenges with her son in school, like many other employees. So we're trying to add on to that job description a little bit, looking for someone with a little bit more digital background that can help us, coordinate our go-to and, go-to meetings and things like that. We are doing apps here with current people on our list. So we have some real good ones that we did just within the past couple weeks that we continue to send out. So we, as we do what we call a one-day app, it remains in our menu, and then we can send it out continually. So we had Sherry Corbett. We also posted that on Facebook. Julie Bennett. And it went on Facebook, and we actually got a lot of comments on that Facebook post when Julie just did such a great job on her testimonial. We have Merrill, he spoke on resident council, and then I have Jeannie Buchanan's that I'm going to be posting. And we send that to our waitlist members too, to encourage them, to want to still consider this as a transition.
Okay. Are you there?
I'm here. Did you want me to talk about anything else?
No,
Okay.
You're good. Thank you. And of course, there's I was just having a conversation with Jill yesterday, and Jill's just a go-getter, and we've been clipping along, and Sean, we have 4 vacancies, and I know that adds pressure and stress to Jill, but I know that she is up for the job, and that together we will get through this. And she also shared with me that one of our competitors yesterday had 4 vacancies in February, and as of yesterday, they now have 30 vacancies. So, just staying ahead of the trend and making sure that we're doing all the right things with our virtual and digital marketing and so forth, and using the resources and support that LCS can provide to us. I think we'll be able to stay ahead of the curve. So that, Jill, thank you very much. And I'm going to.
If I could just add one, could I just add one thing?
Yep.
We also, I did send out in the newsletter an article, which this will be the 3rd week, encouraging the residents to continue to refer to us. If we can get the residents to provide us with names and encourage their friends to come, that would be a very appreciative help at this point. So, if you can spread the word around that, we'd certainly welcome them, give them the VIP treatment. So, thank you.
Awesome. Thank you very much, Jill. Does anyone have questions for Jill? Hearing none, I am going to advance the slide to Darlis Jones, who is our Regional Sales and Marketing Director. And
Sorry. Thanks, Sean. Good morning, everyone. Can you hear me all right? Hopefully no
Yep.
echo here. Hopefully no echo here. So Sean and I talked a little bit about what to cover during my little section here and what would be important for folks to hear. We really wanted to focus on kind of the current marketing environment. So just riding on the coattails of what Jill has talked about locally and what she's experienced locally, what we're seeing really in the industry overall and in LCS communities. If all of you were on the call, our last call, we did highlight and talk about some survey work that was done through LCS Market Research, where we polled current prospects from across the nation, across communities, as well as a survey that was done. It's called the Sounding Board, and it's information from a survey that was done with current residents. And we talked about the results of that. So what I wanted to bring to all of you and kind of share with you is some survey work that has been done through industry experts. So a couple of our strategic vendor partners with Glenn Devens, and then kind of a thought leader with a gentleman from the CEO and president of ASHA. They have done some really significant, interesting survey work through 3 different waves of surveys. And so they started in April, they spread them out 4 to 6 weeks. And so one was done in April, May, and June. And really the purpose of this survey work was just to kind of gather what they're seeing in the industry, the communities are experiencing as far as inquiry generation, et cetera, or sales performance activity, confidence levels of the consumers and their sentiment as far as independent living, CCRC communities, what they're seeing in this environment or feeling about communities in this environment, their perceptions on safety during this pandemic, and then they're just their feelings overall about moving into a community during this time. And so this slide here, just a quick snapshot of what communities are experiencing as far as sales prospecting activities. And clearly, you know, the COVID, obviously we know the COVID environment has really changed the model. And so communities overall have experienced a significant drop in inquiry generation, in phone out activities, obviously appointments or tours, visits, you know, nobody can have people in, so that's obviously been impacted. And then overall move-ins. So a significant decrease, as you can see, in overall activity. But I think the good news that Jill shared, the experience at Sand Hill Cove has been different than what we're seeing on the slide here. And Jill and team have really been able to not miss a beat and keep those activities going, even though your inquiry generation has been down by about 24% compared to last year at this time. Regardless, Jill and team have been able to really keep that momentum going. And I'll touch on the video messages shortly here. So just a snapshot of some of the results from this overall, from the survey work that was done. I'm trying to use my pointer, but I'm not the presenter. So you can see from wave 1 on through wave 2 and 3, the overall sentiment from prospects and their confidence level. So while sentiment and confidence are low across all measures, there is definitely a significant upward shift in May, so wave 2, and then it held steady in June. So this is overall confidence in terms of how prospects are feeling about the current environment. Next slide, Sean.
Yep,
Oh.
Darlis, I did give you control, so try and use your mouse.
Oh, can you see my mouse?
Yes, I can. Mm-hmm.
Oh, okay. All right, so on this slide, what we're seeing as far as the confidence level, is the community a safe environment? So how confident are you that an independent living community is a safe place to live during a health crisis like COVID? You can see obviously in April, confidence rating was pretty low at 22%, a definite increase in May, and held steady in June. So folks are feeling more confident as we go through these months that the community itself is a safe place to live. I like to look at the fact that 62% really are either confident or feeling, neutral, which we would have expected to be probably a little bit less. Next slide. I don't think I can advance it, Sean. Okay, yeah. So then as we look at consumer sentiment related to the question was, do they agree with this statement that during a health crisis, COVID-19, that an IL community is more safe or less safe than being at home? Again, lots of lack of confidence in the early stages. Obviously, everything was hit so fast and so hard, and not a lot of confidence there, but that is increasing and slight decrease in June. But the good news is that there hasn't been a significant decrease in feeling that a community is a safe environment to be in. So next slide. I like this one because the question had to do if folks are agreeing with the statement that I am more likely or less likely sorry, I can't read what's at the bottom, it's so small.
Or just as likely. Yeah, it says I am more likely, less likely, just as likely as pre-COVID-19 to consider.
Yes. And so 44% less likely. We expected that to be just, a lot higher in this environment. Just as likely to make a move, 46%. So that's very encouraging. The 46% and the 8%, they're still feeling confident that they're likely to consider a move. So it hasn't impacted that likelihood as much as we anticipated or thought. Next slide. So again, just kind of the top line that we talked through. I'm not going to go through all of this. You'll have this in the deck once you receive it. I assume the deck will be sent out to you after the meeting, but just, positive signs across all segments. So while the sentiment and confidence are a little bit low, waves 2 and 3, we're definitely showing an increase and a bit of recovery as it relates to that consumer sentiment overall. I'm not showing you all the slides from this study. There were some geographical differences as that was a part of the study looking at differences in the Northeast, the Midwest, and the South. So next slide. Oh, Sean, did you skip through some slides? Oh, okay.
I think that was it.
Now, there were a few that I had in my original deck that were left out. So one of the slides that I showed or that had in the original deck had to do with, so even though we see confidence levels evening out, and we see consumer sentiment kind of staying the same, the point of this study is that we still have a lot of heavy lifting to do in the industry and especially in this next year. So as we look at, that inquiry generation and the getting people to come back in, it's still a marathon, but we're in a different leg of the race, if you will. So next year, and Jill kind of alluded to this as well, there's a lot to overcome. The media, obviously, as you all have seen and heard, is a real challenge because senior living has been really lumped. Nursing homes, we've all been lumped into one category. And so when we talk about the independent side of the communities, we have to overcome that media impact and the negative environment that the local and national media has put us in. So we need to really focus on moving forward on building up the leads, which we obviously are working with our vendor partner, Glenn Devens, to do that. And then really just embracing that change and the innovation. We had to, I alluded earlier in our session that we've really had to make a very significant shift to that virtual platform. And that's been, quite a challenge for some communities to embrace, especially if they're in a market that is not as tech savvy. So lots of work to do there, and we've really tried to bring a significant amount of resources to the communities to make that shift and to innovate and move forward in this environment. We all talk about a new normal, and I don't think we're going to be going back to what normal was before. And so tactically, as we anticipate and look at next year, we will need to continue to be flexible and nimble as we move through this environment. So lots of virtual tactics have been brought to the table. And Jill and her team have done a great job. She mentioned the one-day video, which is an app that all communities have access to. And we've created some contests around it. And actually, Sandhill Cove was in the top 10 of all LCS communities, primarily because of their adoption of the one-day video messaging, where they send out these little message clips to their prospects. And so they've done a wonderful job at that. And just, really focusing on nurturing that lead base and guiding that lead base along strategically. It's a lot harder in this environment, and it will continue to be so next year, as Jill alluded to. So that's what I had. Any additional questions? Oh, right. So I think somebody had presented these questions in advance of our session today. So are there plans in place to put together a formal post-mortem on the experience of COVID-19? I don't know that there are formal plans at this point. Obviously, through the sounding board, through work that market research, LCS Market Research is doing, and the presentation that I just shared from Glenn Devens, there is ongoing work related to both prospect facing as well as current resident facing, and what is the experience in this environment. That work will continue, and my thought is that it will continue well into next year. we don't know when we're going to be through this and when it's going to be done. It will be a long time. So we will continue to do what we need to do to figure out how to be flexible and nimble and adapt to this new norm, if you will.
Okay, great.
Yeah.
Any questions for Darlis?
Sean, George, I have a question. Can you hear me?
Sure. Yeah.
I can.
Mhm.
Okay. I'm curious, what reaction are you getting from prospective residents when they're asked to sign this waiver?
So Jill, I think Sandhill Cove in my communities is the first community to really start. I'm not sure if you have started yet. We are just on the cusp of rolling it out to communities to have prospective residents sign. Jill, do you have any feedback on that and what you've heard? Have you actually had people sign it yet?
So yes, I do have feedback. It's actually positive. We talk with them over the phone first before they get there and just let them know that we will go through a screening with them to just as far as our COVID protocols, safety protocols. And then when they do come in, they'll actually be signing a waiver, just recognizing that, you know, there is risk here like anywhere. You know, it is prevalent within our county. And they will also just sign a little personal profile form, and which is what we call our inquiry card. And we've had no problems with anyone saying they don't want to come to the appointment, and no one has had a problem with signing the waiver. And I will tell you, the waivers are everywhere. I had to sign one for my son's school, so for him to go to school. So I think people are realistic to that.
And I think we'll see more
Thank you.
and more of that as time goes on.
I was just going to make a comment, Sean and group, that we're, as you know, we heard from Cassie earlier, and then we are using the waiver for the visitors, obviously the prospects, but visitors and vendors coming. And Sean, you and I were emailing earlier that we're really not getting a pushback from the visitors or vendors either. I mean, maybe a few comments here and there, but that seems to be going well. That visitors certainly seem to understand, because as you said, we're all having to sign them when we're going to the beauty salon, myself, or anything like that, to sign a waiver. So it's probably not as much of a surprise. Sean, agree? Any comments?
Yeah, absolutely agree with you. I have requested that as visitors are coming through and the guards are reviewing this with them, that if there is any pushback or any concerns, that I'm to be contacted immediately. And I've provided them with my cell phone, and I have not received any calls, or there's been rumblings. There's been a few people who have grumbled about it, but they've actually signed it. Okay, with that, we are going to jump over to Sam. And Darlis, thank you very much for spending time with us. I know it's early on your part. You joined us this morning at 6:30, so you're probably ready for a nap right about now.
Not at all.
So Sam has joined us, and Sam has really been working diligently and with not only our community, but also serving as a representative on the LCS corporate team that's looking at refurbishing. And so because of that, she has been able to identify some savings for us. And so I just want to send it over to Sam, and he can give you a high-level view of what he's been working on and how he's been saving you money. So Sam?
Good morning. So the first couple items I'm going to go through are the task force items, and then I'll get into the refurbishing piece. But the water gator is one of the first items we looked at. And what that is a valve that you can put in your main backflow, and the long-term goal is to reduce your utility bill by 10%. You can see upwards of 40%, but we're starting with 10% as our base, and then over a period of time, we can evaluate the true savings with data. But the valve was put in July, and it creates a compression zone that removes air from the water before it passes through the meter, because the meter doesn't recognize whether there's air or water passing through it. So that was the first item we've done, and hopefully by end of September, I'll have a couple months worth of data, and we can look at the bills and review the savings and then report on that. Next slide. The Whiz, I think everybody's seen the Whiz vacuums running around the community. We currently use them in multiple buildings. We launched them July 30th. The big takeaways right now, they've allowed us to do more vacuuming on a consistent basis than we've ever done. So we run the vacuums daily in multiple buildings, and they run for about 4 hours a day, which has allowed us to cover about 388,000 square feet of vacuuming across those 3 buildings in the last 30 days. So the plan over the next several weeks is to incorporate the Whiz into more areas that we maintain. And right now we have a couple challenges with the pavilion not being set up in a standard mode, and then some of the other areas that have been repurposed. So those areas will be able to be incorporated in the future. And then evaluating how do we use the Whiz to increase our overall look in the community? How do we repurpose time for our housekeepers to really take a look at that more detailed cleaning, the flexibility that all your residents are looking for in your apartments? Can we spend more time doing what you're asking? And then, extra services. Can we generate enough revenue through extra services that we can't currently provide due to our staffing limitations? And then Behr Paint. So we've converted from Sherwin-Williams over to Behr Paint, and through doing that, all of our interior painting is now Marquee, which is a Behr product. It's their one coat product. So by switching over to the Marquee one coat process, we can reduce our labor and material costs on interior paint work, not just in our refurbishing, but throughout the community. That cuts our, obviously the labor perspective of not having to put on 2 coats. You pay a little higher cost for the material up front, but it still works out to be less because you're not buying the quantity. So Home Depot and Behr are currently working on creating an all Marquee paint deck to support marketing in the process, so that when they have a prospective resident coming in, they can provide a Marquee only deck that has all the one coat colors in it. So then diving right into refurbishing, working with Daltile through CPS, our care purchasing program, Behr Paint, and then a local cabinet vendor on some of the quick, not really quick, but some of the items that we can identify to reduce our expenses in refurbishing. So working with Jill and Daltile and these vendors, we've found some savings. The big ticket item right now is the countertop selection. We've converted over to Daltile. So the material cost we were using previously was around $2,500, and the same size material through Daltile with the very similar pattern is around $1,196 per slab. So to put that in perspective, it takes between 2 and 2.5 slabs of quartz material per apartment to do the bathrooms and the kitchen. So you would recognize a $2,400 to $3,000 savings per apartment as we move forward. And then currently working with Jill and Daltile on new wall tile selection, floor tile selection, backsplash selections, and we're getting close to wrapping up with that, so we can get all our pricing in on that. So I mentioned the Behr Paint one coat process. So depending on the size of the apartment, we can recognize a $600 to $1,100 savings per apartment on the paint process by not having to apply a second coat throughout the apartment. So when we're presented with an apartment that requires new cabinets going forward, we're using what's called a flat pack cabinet. They're all wood cabinets with the shaker style doors, the same look and cabinet that we have now. And that saves us around $1,600 per apartment, depending on the layout. And then last but not least, looking at the contracted side of it and the labor side of it, looking at the physical refurbishing process of the apartments. And when I say working on what scenario is going to work best, I mean by working with our contractors and our in-house staff, what is the best scenario to reduce expense in refurbishing? Because depending on what the general contractor has for resources, some things make sense for them to do and some things don't. So still evaluating that, but I'm working on a scope of work for each refurbishing apartment, and then having a general contractor bid that process. So I've talked to 3 different general contractors so far, and once the scope is created, we can send that out and start look at the bidding and see what we can do there. So that's pretty much what I have on updates for refurbishing and the task force. Any questions?
Hearing none, I just want to say thank you, Sam. On top of everything else that he does daily and the various, and then in the midst of COVID, he has been working diligently to identify savings for our refurbishments and just our overall community. So a huge shout out to you for your leadership and taking that risk. We appreciate you taking charge of this. Thank you.
Hey, it looks like Elmar has a comment.
Yes. Hey, Sam, tell me about the new lawnmower system. I thought that was interesting.
So I didn't put Husqvarna in here yet because I haven't worked through everything with Husqvarna, but you have noticed 2 mowers. If you're here on site, there's 2 mowers outside by Waterside, and one of those 2 mowers is actually a prototype that you can't even go out and purchase yet. It's a satellite guided mower. And the first area we set that mower up in wasn't the ideal location for that, just because it was down by the water and it wasn't an all-terrain mower. So they're going to change out the wheels and we're going to relocate that to see how it does in another area. But we also have an all-wheel drive unit that is down on the opposite side of the dock, and it goes up that massive hill and mows that whole area, rain or shine, doesn't matter. And just the perspective that these mowers don't make any noise when they're in an area. I've got tremendous feedback from residents and sitting on their patios and watching them, and even had one resident tell me that even though this one's not working right, let's figure it out, because just from the sound perspective, it's an amazing thing. So a lot of good feedback. I'm just waiting on more details, and Husqvarna has to provide the number of mowers it would take. It's not a 100% solution for the property. I don't look at it as it's going to take care of all landscaping, but it will certainly supplement what we're currently doing and take care of some of these resident areas where we don't want a lot of noise early in the morning, multiple times a week, and allow us to really provide a better quality product and service to the residents. So,
thank you.
Yeah, hey, I wanted to give a shout out to Sam on this too, because I'm aware of a couple other communities. For those that aren't aware, Sand Hill Cove has been identified as with our CPS process that we're going through as one of those communities basically that will help prove out some of these concepts. And the Whiz in particular, which I hope we do some renaming thing at the community and find a better name than Whiz for each of those vacuums. But side note, Sam has really taken this and run with it, and that has not been the case at other communities. So there's been some great progress made at Sand Hill Cove that we're actually able to leverage other places, but you're getting the benefit of that. And that's one of the reasons why you have the mowers there, is because you have someone in Sam who is able to take those and figure out and work with them, get them operating, and really kind of think out of the box in a couple different ways too, in terms of how it can benefit the community. So just wanted to give him a shout out, and both you and Jill, on the refurbishments. For those that aren't aware, that's probably few and far between. Our refurbishment costs were quite high, and both have done a lot of work, and you've seen the evidence here of really trying to bring those costs down without significantly impacting the look and feel. I mean, obviously we want those refurbishments to continue to look very high end, and so leveraging some of the things that LCS provides, but it also requires on-site leadership to be able to take advantage of those. So I just appreciate all the work you both have done on those.
Thank you.
Yay, good job.
Sean, I wanted to ask you a quick question. Tony brought up the naming problem. I wonder if there's any truth to the rumor that those vacuums have been named Sean and Sam.
No, there's no truth to that.
Oh, okay, sorry.
Well, you'll have to decide which one is Sean and which one is Sam. I'm good with
All
that.
right, Tony, moving on to you, insurance costs.
Oh yes, yeah. So and I know we're kind of have the tickler all through this, and if my timing is right, it looks like we are already over. Oh no, we still have, yeah, we are over time, aren't we? And I want to make sure we have time for questions. So I think maybe on this one, I'll let questions flow. But a couple comments that I did want to make regarding this is, first of all, as I've mentioned before, I do work with other partners and investor partners on other communities beyond Nuveen, and one of the things, while I want to be careful, there's nothing positive really about these types of increases, because they are very significant for insurance, but it is something we're seeing in the industry pretty much across the board. And relative to what others are experiencing, believe it or not, these increases are actually favorable. And that's in one case, working with one of the REITs that's heavily involved in the senior living industry, as well as another owner that we have a pretty substantial relationship with. When we were going through insurance on these other communities that they have a partnership in with us, they were actually surprised that the rate increases were as low as they are relative to what, and I hesitate to even use the word low, but again, relative to what they're seeing in other industries, or with their other communities, with other insurance providers, these rates actually are pretty attractive. The other thing I did want to point out, we're not just in our insurance group is doing a really good job, I think, in terms of trying to balance different risks. I mean, you heard earlier the whole COVID coverage that we do continue to have. That's actually very uncommon, that Sand Hill Cove and our other communities are able to continue to have that coverage. So that's I think a big win, and certainly part of the increase, the fact that we continue to have that coverage in our policies, even though it's still relatively low. But we do continue to evaluate, is the coverage the right coverage? And the one area that I'll point out that we opted to continue with this year, but if we continue to get some of the anticipated increases next year that we may consider eliminating, and it's going to cause a little bit of a shock to some people, but the wind buy down policy that we currently have is getting very, very expensive. And so we'll evaluate that as it comes out next year. But keep in mind, one of the things that LCS Advantage has been able to do is, even with the deductible in our policies, remember, instead of it being by community, which a lot of policies do. So your deductible is, takes the value of your community, and then you have a pretty high percentage off of the entire community. Ours is actually by building, and so it's building by building. So the benefit is, if we have a wind event, if there's a hurricane that creates damage, unless it damages the entire community, which is much less common, it tends to be, one or two or three buildings that tend to take the brunt. That deductible will apply just to those buildings that were impacted. So it does bring the deductible per instance down quite a bit. So again, not to get into the weeds on that too much, as I'm already starting to, just keep in mind that as an example of areas that we are looking at. At what point does the cost of the insurance become too overbearing for the risk that we would take to not have it? And that's one that I know Dan Kosmicki, who many of you I think have met in the past, has on his radar screen as well for next year, to make sure we're really evaluating those, to make sure that the cost benefit on some of those extra policies are actually providing the benefit that we think it's going to. So more on that obviously as we start looking at the 2021 update, so mid-year next year. But it really just to give you an idea of, that's the thing I've personally appreciated with Dan and his group, is it's not just, well, here's your next policy, here's the increase, it is what it is. They are actively looking at ways that we can reduce those costs. Even looking at deductibles, is the deductible the right level? If you remember last year, we took a higher deductible on one of the policies because the premium was so much less to do that. Well, that kind of got right-sized this year, and we went back to our former deductible because the benefit of carrying that larger deductible was no longer there. So we will continue to look at that. Dan and his group in particular, but that's part of my responsibility as well as we get these updates, is to make sure we're really being wise in terms of what we're paying for. So with that, I know, yeah, go ahead, John.
No, I was just going to say thank you, Tony. And I know insurance is a hot topic, and some of you have served in the insurance industry. Do you have any specific questions to Tony about insurance? Okay. Hearing none, I'll just go real quickly through the next two slides, and they're real brief. So 2021 budget, this year has been very different because of COVID-19. We want to make sure that we are capturing the trends and that we're budgeting appropriately in 2021, so we don't have misses in our budget for next year. So with that, we would have hoped to have shared something by now with the Finance Committee, but there's still some tweaking of those, some of the concepts that we're working on, and some of the items that we need to be mindful of. So some of that is still fluid and still moving. So I don't have anything more on the budget than that, other than just to say, we're budgeting occupancy at about 95.5%. Skilled nursing has been budgeted 2% less than what we were at last year. Assisted living is being budgeted at 95%. We have included all ancillary revenue. So I think Debbie was talking earlier about guest room revenue and lounge income and all of that. Quite frankly, we are still evaluating that to see if that is appropriate to budget with that additional revenue, depending on the way this pandemic will go. So it's really too early to talk anything more or provide any more information on the 2021 budget. But if you have any questions on that, I would certainly entertain them now. But I would suspect that we would be having more detailed conversations with Bob here, you know, maybe within the next couple of weeks or a month or so. Okay. The other question was about the MLOR, and we submitted our MLOR and our annual reports back in June. We have not heard from them, and I know that Dan Merriman, our compliance analyst, continues to reach out to the state to say, hey, you know, has it been approved? Has it been approved? So the question was, why hasn't it been approved? And really the response is that the state is backlogged on it. In fact, Dan reported to me that some of the other Florida communities, they haven't commented even on their fourth quarter reports yet. So I think the state is just really backlogged. So we'll be talking more about any core transfers or anything of you know, anything of that nature with Bob and Tony and Roberta. But that question was submitted to me about the MLOR calculation, and that's what I know at this point. So we are over time, but in the spirit of making our residents feel like you have input, I do. If you need to drop off, you know, feel free to drop off, but I would just like to ask, you know, are there any questions? We covered a lot, big agenda, but if you have any questions, you know, feel free to raise your hand and take yourself off mute, and we'll entertain them. You all are as quiet as a church mouse. Okay, well, hearing nothing.
It's because you muted that. It's because you muted everyone, Sean.
I didn't mute everyone.
I know, I'm just kidding. Yeah.
I'm like, wait a minute, did I do that?
No.
For next time. But so with that,
I think we do have one question, maybe.
No?
Yeah.
Okay.
Maria?
Roberta?
No.
Roberta, Tony, do you have any closing comments?
Yeah, I want to hear Maria's question.
Oh, you're on mute.
You're on mute.
You're still on mute. There you go.
Can you hear me now?
Yes.
Yes. Okay. I just want to say I thought it was a really informative meeting, and there was a lot of information, and it was a great overview of all aspects of our operation, and I really appreciate the effort that was put into putting it together.
Well, thank you. Thank you, Maria. And as the head of our design consultation committee, I thought you were going to ask about the pavilion update. So we're anxiously awaiting for those for the architect to submit those contract bids to us too. So once we get those, we'll circle back with yourself and Bob and Merrill and talk through that. So hopefully mid-September.
Yeah, that was definitely on my mind, but there was a lot covered this morning, so I didn't bring it up. I do have a suggestion for naming the new lawnmowers. I would suggest Fritz and Fred.
Okay. All right. Thank you. Roberta, you want to close this out?
Sure. I thank you for your comments, Maria. Hopefully you felt that this was informative as well. I really enjoyed. I missed the last one, and glad to see everybody here virtually. Miss you in person, but hopefully that went well. Sean, I know we have limited time, but do you want to mention really quickly for those that might not know about our strategic planning marathon meeting virtually tomorrow?
Sure. Yeah, that's great. Thank you, Roberta. So Merrill gets the communication exchange all over again tomorrow. So tomorrow we have our annual strategic planning session, and I am delighted that to have Merrill and Bob joining us. That is something that we started 3 years ago with incorporating our residents into it. And in addition to the residents, we now incorporate our corporate partners. So Darlis, our regional sales and marketing director, Roberta will be there with us, and Tony. And prior to us becoming LCS, we did not have that inclusivity. So, you know, that great opportunity for collaboration. We're going to be doing this all virtually. We do have a facilitator that will be here on site, but we will have about 5 groups of people that will be participating virtually. It will include our leadership team and our second-tiered management team. So we're going to try and be productive virtually on the strategic planning. It's a really exciting opportunity. With that, then we have made the commitment that every other month there will be a core group of us that will meet every other month to talk about the strategic plan, because we're going to be actually doing something different that we've never done. This is, we're going to start plotting the plan out and identifying what the dollars are needed. And so I think I'm really excited about this opportunity because I just feel like we're all on the same page. We have corporate support and of corporate voice at the table, whereas, like I said before, that did not exist, along with the residents not being at the table. So some really exciting times. So thank you. Okay. With that, thank you very much, everyone. What I will do is we will print this deck off, the presentation off for you. If you would like a copy of it, I'll have it at the front desk with our guest services coordinator, and you can stop down and pick that up. Because it is 36 pages, I'm not going to print it off and give it to everyone, but we'll print off 10, and if we need to print more off, you know, feel free to come down and we'll print some more off. But with that, thank you very much, and have a great rest of your day. Bye for now.
Good afternoon, everyone.
Thanks, everyone.